They're certainly the heroes on the front lines of our COVID fight. The nurses and doctors now experiencing burnout, even PTSD, as unvaccinated people pour into the emergency rooms.
Tonight, a new strategy to convince the holdouts to get a shot before it's too late. 75% of the state has received at least one dose of a vaccine. 68% are fully vaccinated. Governor Polis wants more doctors set up to administer the shots and hopefully boost these numbers.
The virus is the enemy, and we have the secret weapon to defeat it. Thanks to the triumph of modern science, we have a highly effective vaccine that can defeat this virus, and yet we have a quarter of Coloradans who have are not using that weapon yet.
Jeff Todd taking a look at how the surge of unvaccinated patients is taking its toll on medical workers. We begin with Alan Janae and an update on the vaccines. Alan, the governor wants people to get a shot from their primary care doctors.
Well, when you think about this, Karen, all through the pandemic, health experts have been telling people to listen to their doctors. So you go to your doctor tells you you should get a COVID vaccine, but then they send you somewhere else to get it. Among those, pediatricians who are having a lot of conversations with parents about this. And of course, they give children a lot of vaccines. You can maybe now add COVID vaccinations to that list.
All our standard childhood vaccines are here.
In his office in Castle Rock, Dr. Michael Malobsky is looking at what he already has for vaccines.
We have refrigerators full of normal vaccines because we give them out literally hundreds of times a day.
Dozens of vaccinations combined before children reach kindergarten. What he hasn't done so far is give the COVID vaccine here.
You can only get it in certain size batches. You have to have a very meticulous recording system and a person who's really just dedicated to doing that and cataloging.
They will get the doses they need, some financial support to do the outreach they need.
With the governor's announcement, physicians like Dr. Malobsky can apply for grants to start providing COVID vaccines, along with advice from the doctor you probably know best. Colorado's higher vaccination rate among adults may help contain the spread in children, but schools started only weeks ago.
COVID cases are popping up in the schools now, and we're trying to stay on top of that.
He expects some tough conversations. He's already received calls from some parents asking or demanding that he write their children mask exemptions.
And your child gets another child sick who's on chemotherapy or who has a serious underlying illness that ends up in the hospital or worse. That's my responsibility.
The vaccine conversations, too, could be difficult, but he believes necessary.
I'm going to consider it probably the most important thing I can do to help us in the pandemic, to help our children during the pandemic, is help them get vaccinated.
Well, Dr. Malobsky believes once the data is in, vaccine eligibility will be extended to children from 5 to 11 years old. When that happens, he believes a lot of these conversations are yet to come. And many have been so difficult, he says he worries about one thing down the road, whether we might end up with schools with children who are vaccinated and others with children who are not. In Denver, I'm Alan Janae, covering Colorado First.